Welcome to Stories from Social Care Leaders, a podcast hosted by the University of Salford, which is dedicated to amplifying the voices of those shaping the future of social care. So in the first series, we focus on strategic level kind of perspectives with a special emphasis on social care nursing. We'll be speaking with key figures in the field, discussing topics around policy, education, research, to really highlight the kind of ideas and experiences driving change, I guess. So today we're joined by Dr. Sarah McGloin, the head of Grants and Impact at the RCN Foundation. It's nice to have you, Sarah. So yeah, if you could give us a bit of an introduction to yourself, about your role.
Oh, thanks, Siobhan. So I'm Dr. Sarah McGloin. As Siobhan said, I'm the head of Grants and Impact at the RCN Foundation. So just to talk a little bit about the foundation, we're an independent charity for nurses, midwives, healthcare support workers. You don't have to be an RCN member to benefit from our work. We provide grants, basically, so a grant-making charity, and we provide grants across 3 streams. So we have a benevolent service that provides hardship grants and signposting for individuals who are in financial difficulty. We provide education grants to support all members of the nursing, midwifery and sort of healthcare workers sort of community with their sort of development, professional development. So we fund any courses from clinical skills courses through to PhDs and prof docs and anything in between. So a lot of advanced practice programs as well. Quite often looking at the research modules as well, because the funding often isn't there for those particular parts of those MSc advanced practice programs. And then the final area, last but not least, is research and innovation. And actually, this is where the work sits that we're supporting Salford with around adult social care nursing. So we provide funding for nurse-led, nurse or midwifery-led research studies or projects. And we sort of identify with our trustees our priority areas. And adult social care nursing has been a consistent priority area for the foundation since, I think really since the foundation was started. So we were started 15 years ago. And yeah, adult social care has always been on our radar and our agenda. Other areas which are our priority areas at the moment are children and young people's mental health and emotional well-being, and learning disability nursing as well, in particular looking through the lens of health inequality and the role of the registered learning disability nurse in that. And actually that tips over as well into some social care stuff as well. So yeah, that's sort of the foundation in a bit of a nutshell, really.
Amazing. Doing a lot of good work, sounds like.
Yeah.
So I guess I wonder if you could, in your own words, I guess, kind of explain the foundation's role in really addressing the kind of current challenges in social care nursing.
Yeah, I think as I say, for the foundation, social care nursing has always been a priority area. And we funded a whole programme of research way back about 10 years ago into care home nursing in particular. So it was looking at that particular area of social care. And this involves scoping reviews around what nurses were doing in the care home sector, supporting other sort of research projects. There was a programme called the Peach Study, which was run by King's College in London, and that was looking at supporting early career nurses in social care, sort of supporting their professional development through a pan-London programme with a competency package and a module around working in the sector. So these are projects which we've funded for a number of years back, actually. And then we had other priorities that we were moving on to, but we were always being drawn back to social care. And it was a couple of years ago that Deborah Sturdy approached us and wondered whether we would be interested in supporting some further research, further work around research through, funding the first chair in adult social care nursing. And
Mm.
I'll be honest, when we took it to the trustees, they were absolutely delighted to be able to be involved, and we really felt that it would almost be a legacy piece for all the other work that we had supported all the way through. So yeah, that's and the reason as well, I think the reason that we focus on this area is we are aware that it's a huge part of nursing, and it is very, very under-resourced in all ways, not just for the workforce, but around education, around research, around practice development. And a key sort of approach of the foundation is to try and improve evidence through evidence-based practice, nursing care, and person-centered care. And so identifying parts of nursing where maybe there's not as much funding available, or as much support, or as much focus, is very much sort of part of our sort of makeup as well. It's what we do. So yeah, that's why we're very interested in adult social care nursing.
Amazing. And I guess, like you say, if those kind of focuses within social care nursing, or priorities within it, will change over time. Like you say, you started off many years ago looking at care home nursing.
Yeah.
How has that changed over time, or where do you see those priorities being kind of moving forward, I guess?
I think this is sort of where the chair's work is going to really become important. So I know that Professor Claire Pryor, who's the first RCN Foundation Chair in Adult Social Care Nursing, and you, Siobhan, have been doing a lot of scoping work. So I think Claire started in July and you started in September, didn't you, 2024? And both of you, I have to say, have hit the ground running. We've been astounded by the amount of work that you've done already. And actually, that exercise of scoping out, what you've been looking around sort of care home nursing at the moment, haven't you? And what the challenges are around advanced practice and things like that. So that piece of work will identify gaps in the evidence base, and that will drive the future of areas of research, won't it? But also, I think there's lots of roundtables going on at the moment. I've had an email drop into my inbox today about another roundtable around social care and social care sort of practice. And I think that the more people are now starting to reflect and talk and identify and share experiences, that's where you're going to start to see where the need is for that research and that evidence base to be built to underpin this part of the nursing profession. So and I know that there's some research signaling demand work going on, and across all 4 countries as well, there is a discussion around where what is adult social care nursing, where is it going, and what are the priority areas. For us at the foundation, as I say, we started off in care home nursing, and that's been a tremendous piece of focus for us. But we're literally just about to fund a piece of work looking at registered nurses, learning disability, who are working in adult social care, and where they're working, what they're doing, but also their identity as a nurse, because anecdotally we're seeing, as nurses, RNLDs move into social care, they start to lose their identity as a nurse, and they struggle with revalidation, and actually then they fail to re-register and they drop off the NMC register. That has huge impact for sort of practice placements and the triple SA assessments for nursing students, but also for the profession as a whole. So as fewer and fewer, if there's fewer RNLDs registered, then that has an impact on the overall workforce. So we're funding a piece of work around that, around what is this, what is happening, why is it happening, and actually should it be happening, and what can be done to sort of support nurses working in that area. So it has shifted quite significantly, really.
Yeah, interesting. And I guess it highlights then that the priorities emerge from the work itself. So the RNLD work, the findings then will inform, okay, what needs, or what's the kind of pressing findings that needed responding to, I guess, in research.
Yeah, no, absolutely. And I think because there hasn't been a chair in adult social care nursing before, that sort of scoping and baseline work hasn't really been done. I mean, it's been done in pockets, but there hasn't been a sort of coordinated approach. And absolutely, that, you know, these first few months of Claire's sort of role and your role is absolutely fundamental to plotting out the next few years of this, you know, of this piece of work. And it's nationally as well. That's the other joy about it. It's not just focusing on particular countries, it's or particular regions even. It's absolutely national, what's happening in the national picture.
Amazing. And I guess when I think of social care nursing, I think of I guess the more I work in this role, the more I think of the kind of diversity of people that work in social care nursing and the diversity of social care settings, which I think I probably previously hadn't recognised. So I guess I'm interested in I guess the RCN Foundation's role in working to empower all those different types of voices, I suppose, really.
Yeah, I think it's interesting, isn't it? Because I'm from a critical care background, and I had very little understanding of what adult social care nursing was and what adult social care nurses did. And certainly since I've been working in this area, my goodness, my eyes have been really, really opened. And actually, I think the foundation's role is very much around we don't want social care nurses just to be talking to social care nurses about what social care nursing is. We want to broaden the discussion and widen the understanding of the role. So what we're trying to do is sort of support discussions outside of adult social care nursing, and the work that we're funding is really about driving forward that area of the profession, so that other nurses, other healthcare professionals, but also the wider public understand what an adult social care nurse does, who they are, and what they do for you, and the level of autonomy that they have, but the level of skills and expertise, and it's really high-powered stuff, and there needs to be greater awareness and greater understanding of what an adult social care nurse does. So that's what we try to do.
Yeah, amazing. So I guess it's that type of opposing or kind of challenging that kind of silo working, really.
Yeah, absolutely.
Kind of putting people into conversation with each other, or groups or communities into conversation with each other. So those things can develop.
And also making sure that the outputs and the outcomes of the work that we fund is disseminated, so that the right people are getting to hear what's coming out. So we think constantly and work constantly on how we can disseminate the work that's coming out. And also the other thing about the work that we will fund and we will support is we absolutely understand the importance of academic papers. We absolutely do, but actually we want to make it accessible to all. So outputs it's really important that any outputs are tangible outputs. They have an impact. So they might be a tool, they might be a work, a work package, they might be an online course, for instance. So the things that we are funding, yes, they have that academic research element to it, and absolutely academic papers, but actually it's the outputs which we're really interested in, and disseminating them across the community. So yeah, that's really, really important to us. So the dissemination of any of the work is really key, actually.
Yeah, no, I completely agree. I think reaching you can't you need to reach people in different ways and think creatively, I guess, isn't it, about how you can reach people, because you just otherwise you run that risk, don't you, of research just sitting kind of
absolutely. So I think the chair's role, when we were drawing up the plan for the chair, we didn't want it to be a role which was purely focused on developing academic papers. We wanted it to incorporate three pillars, so research, practice, and education, which was quite a sort of shift, really, and a bit of a move. And I think that the team at Salford University of Salford, really understood that and really got that approach. And we're delighted, I think, to have that opportunity and bit of freedom, really, to develop a role which was possibly slightly different to the traditional sort of view of what professors or chairs often do. So that was quite exciting, really.
It is indeed. So I was going to ask about what we kind of think the biggest opportunities are in the area in terms of innovation, but I think we've kind of we have kind of touched on that, all the kind of exciting areas that can be and will be delved into, I guess. I guess it feels important to also think about how navigating that landscape can be perhaps challenging.
Absolutely.
I guess I'm thinking of it in different ways, because I suppose really we've already touched upon a challenge in terms of how social care nursing is perceived societally and the ways in which it's viewed, and kind of fighting back against that narrative can be quite difficult. But I guess, is there other challenges in the...
I think there's an awful... I mean, there's sort of obvious ones around finances. We're living in a world as well where the demographic of society is changing. We're getting an older population with more comorbidities. We have an NHS which is hugely under pressure at the moment from a number of ways. And, there is this shift, isn't there, to move from sort of acute inpatient care to care more in sort of other areas and in community and in homes and individuals' homes. So I think it's a really exciting opportunity for adult social care nursing at the moment. It might sound a bit daunting and a bit sort of like, well, how are we going to achieve this? But actually, things are starting to develop, such as Claire's role and your role, around sort of frameworks where we can support nurses to develop a career in adult social care nursing. I think that's really, really important. And also, as I said, education is a big part of this role. So it's looking at the models of education and how social care nursing is integrated into traditional nursing curriculum, not just at pre-registration level, but at, advanced practice level and, post-grad as well. And sort of, I know Claire is very keen to sort of talk about sort of like flipped curricula. So where social care nursing is the focus for individuals, and then they dip into other areas of nursing as well. So I think that's a huge sort of opportunity, really, for the whole profession and for education. And I think it's really exciting. And I think the fact that people are starting to talk about it is also really timely. So I think hopefully it will start to come together and we'll start to see some things happen in that area. Does that make sense?
No, totally, yeah. And I think it is that, that does make sense in terms of how we think about the kind of challenges in the landscape as being, like you say, as being kind of open to, or I guess, a space of opportunity.
I think I think that's what we need to look at it is, it's challenges and it's very difficult, but actually this could provide or will provide a huge opportunity for this area of nursing to develop and flourish. But in a way, there's got to be an infrastructure there to support that. And as I say, career frameworks are really important, and I know that that's something that is planned and being worked on, and lots of other people are working on that as well. So it would be good to pull all that together, definitely.
Yeah, definitely. Amazing. So I guess, thinking of education, it just sticks in, this is a bit off-piste, but thinking of education, it just sticks in my head how powerful it is, I guess, thinking when you see those students going into social care settings who perhaps aren't the most excited at first.
Yeah.
And then you see the difference that it can make in a matter of weeks. When we did a study in care homes, oh my God, it's incredible. I love being here. I can't imagine, maybe this is my career path. So I think, I guess, yeah, it just popped into my head of how important it is to think about education from different levels, I guess, or from different.
Yeah, and I think it's to give people the opportunity, isn't it, to experience those opportunities. So to make sure, to build in practice placements in settings that are within social care. And we know it's not just care homes, it's a whole range of and variety of settings that people can draw on and go and visit and and learn in, and and really sort of flourish. So I think that feels like quite an exciting point that we're at the moment in education.
It really does. And with the SPQs as well, it does feel quite a lot's happening, which
absolutely,
is nice.
Absolutely. So I think as well, at the moment, the piece of work that's planned is going to get that baseline, isn't it, of what's happening where, who's doing what, and what's being said is done. Is that really what's being done in reality? And, what is the landscape? What does it look like now? And then where can we get to and how can we get there? So, yeah, I think it's, I think that's the thing. I think this is all, because it feels like we're on the cusp of so much in adult social care nursing. It's really exciting. It is exciting, but we have to have the people who are able to do it as well. That's the thing, and deliver.
Yeah, exactly. Yeah. So I guess, looking ahead, thinking to the future, what I suppose you've already touched upon this a wee bit, but how do you see the role of the foundation kind of evolving, or I guess what's your hope for the impact it will continue to have?
So we have committed this is a significant commitment by the foundation in the chair in adult social care nursing at the University of Salford. It's a 5-year grant that we have awarded. But what's really lovely and what we really liked about Salford was that at the end of the 5 years, that is not going to be it at all. This is just the beginning for this role. And we know that the work is iterative. So basically, as you said, a lot of the scoping work, a lot of the foundations that you're building now will drive the direction of the work that's being done at Salford. So, as things are identified or uncovered or identified, and seen as being important to look at, then obviously the foundation will be very aware and listening in and seeing if there's any way that we can support. The other way that we can support is very much through our other sort of grant making areas. So hardship, huge issue at the moment. The cost of living, the squeeze of the cost of living on nurses and midwives and healthcare support workers has been phenomenal. We've seen a huge uptake in our benevolent service and the support that they offer. So we will continue to do that. So anybody who is experiencing sort of financial hardship or challenges, and it could be, due to changes in contracts, it can be, changes in health positions, positions and all sorts of reasons, bring people to the foundation for support with hardship and that sort of area. So we will continue to do that and continue to make sure we're providing the support to individuals so that they can carry on caring for people. And also through our education grants as well. So we have two rounds of education grants a year, in the spring and the autumn. One's literally about to open at the end of this month. And we have a scheme called the Professional Bursary Scheme. So that's sort of quite a broad and open scheme. So individuals who apply for that, if they want to, as I say, do a clinical skills course or do some updating or do, a module, a specific module, they apply to that, and then it goes through a review process. It's a competitive process. And then hopefully, you know, you're lucky and you get an education grant for us. And the lovely thing about our education grants is we have individuals who've received a grant have to report at the end on the impact that has had. And then we then have every year an annual award, our Impact Awards, where we celebrate nurses, midwives, healthcare support workers who've received the grants and, you know, have had a real impact. So definitely we would love to see applications from adult social care nurses and healthcare support workers. So you know, so that we can support through education as well. And it would be great if quite often, sometimes we have specific grants which are related to sort of specific sort of donations that we've had. So you know, in the future we might have a grant specifically for adult social care nurses and healthcare support workers working in adult social care. So yeah, that's one of the things we're looking to in the next couple of years.
Oh, I keep saying exciting, but that's exciting. It's all exciting. Oh, thanks, Sarah. I guess, is there any other messages or anything else you wanted to touch on?
I just think that, you know, working with Salford it's an amazing opportunity. It really is. And, you know, I've learned so much in the last 18 months around what adult social care nursing is. I really have. And it's really opened my eyes, and it's really made me sit up and think. And, you know, I've been a nurse for a long time. And, you know, hearing from social care nurses about what they do in their day-to-day role, how, you know, the interventions they make, how they support holistically the biopsychosocial aspect of care. I think it's absolutely phenomenal. It really is. And I'm really excited personally to see, you know, when the scoping is finished at Salford and you know, the gaps are identified, how we can address those gaps and how we can support the team at Salford to work on those, and, you know, to start to really see some impact in this. And, you know, the other thing that we're really keen to do in the foundation is also sort of develop a pipeline as well of researchers around adult social care nursing. So we've got some fellowships coming up, some postdoctoral fellowships, which we'll be launching later this year. And we really want to sort of help you know, one of those to go towards someone working in adult social care as well. So yeah, there's a lot of exciting stuff coming up, and it will be great to see the impact of that actually on the people who receive the care. I think that's the main thing at the end of the day. So yeah,
definitely. Well, thanks so much. It is really great to hear more and kind of understand, I guess, more, for me anyway, at least, about the foundation's work, all of the different work streams going on, and all of the kind of future work. Like you say, I think having these conversations is important in thinking about what the future might look like, what we want it to look like, and to start those conversations, really. So really appreciate your time.
Oh, you're welcome.
Is there any are you on any social media or any contact details if people listen to this and want to reach out?
So a lot of our information is held on our website, which is www.rcnfoundation.org.uk. You can follow us on Blue Sky, Facebook, Instagram, LinkedIn. Actually, LinkedIn is a big area where, and so what we do in social media is we post when we've got grant rounds coming up, but we also post around the outputs around some of the research and things that we have funded, some of the events that we hold. So every year we hold an annual lecture. Last year that was around learning disabilities and sort of the economic impact of the RNLD role. So and that involves panel discussions and question and answer sort of sessions as well. So yeah, just follow us on social media. You can sign up to our newsletter through if you email into the foundation, RCM Foundation, at rcmfoundation.org.uk. You can sign up to our newsletter, which has lots of stuff in. We won't bombard you with loads of junk email though, so don't be worried about that.
Oh, fabulous. Thanks so much.